Good morning. As you can see, I'm feeling much better. I have my earrings on again. I have my nose ring on again. I'm dressed. I'm made up. I do feel better. And the reason I feel better is because there are people out there, actually elected officials, people we elected to office, who are fighting for us to be free here in Lancaster County, Pennsylvania, where most of our COVID-19 cases are occurring in nursing homes and employees in nursing homes, not in the general public. But the problem is the nursing home employees are allowed to, of course, leave their workplace and go out into the public. And that's how the coronavirus is being spread, at least in my county. And because of that, our Secretary of Health, who was not elected, Rachel Levine, is absolutely refusing to even consider reopening Lancaster County, Pennsylvania. 565,000 people live here, and we are a community of a lot of really small businesses. Okay? And these small businesses have now been closed, unable to pay their employees, unable to make a living for 52 days. And we're going to lose them. They're not going to be able to come back. They're not going to be able to come back at a quarter of the seating or only allowing 25 people in their stores. They're not going to be able to do that. And so I'm afraid that my city is dying. Now, I'm doing this show for my friend Ted, who I went to high school with, and he sent me a really nice message yesterday saying, we always trusted you, Paula, to do a real debate and show both sides of the story. And I know that I've been a little repetitive recently, and I apologize for that, because unfortunately, every day kind of seems like the day before. When you're shuttered in your house, you can't go anywhere. The experts, so-called experts, keep changing their tune. One expert says one thing, another expert says another thing. And when your elected officials are being strung up like a puppet by these unelected secretaries of health who before last month nobody ever heard of, and now they're getting their 15 minutes, and it's going to really be hard to get them to give up being on TV every day and making rules that everybody is running out and following. And so the title of this show is, after the cure, let's answer some questions. I hope there are people out there right now who are smarter than I am, that are keeping track of things, and who will one day write some books, because I will read every book that it will be written, and I hope I live long enough. I will read every book written about the actual virus, how contagious it really was, how was it really spread by asymptomatic people, and what would have been wrong with locking down, shutting in the nursing home people, putting their staff up in a hotel, delivering their food to them, keeping them out of the community, and letting us healthy people who don't have underlying health issues, who are not undergoing cancer treatment, just live our lives like they did in Sweden and Turkey, with basically the same results as those of us who have been locked down for 8 weeks with no end in sight, according to Rachel Levine for Lancaster County. They've had the same results, same number of cases, same number of deaths, but they haven't lost their businesses. People aren't sending their children to bed hungry. So, Ted, I am going to start listening. I'm going to listen to what you said. You made a lot of sense. So what I'm doing with today's show is I'm going to look toward the future, because I am making plans, regardless of what Dr. Rachel Levine says, because she's not my doctor, and she's not the boss of me. And truly, she really doesn't have as much power as she thinks, once enough people start getting the shits of it and just say, you know what, we're healthy, we need to get back to work. And we have elected officials now, congressmen and senators from our county in Lancaster, that are fighting for us. We have a resistance group, 2 of them actually, that are protesting and fighting to regain our freedom, which we never should have given up so easily in the first place. But that's, again, people smarter than me will write a book. Hell, maybe I'll write a book about how easy it was to use fear and misleading numbers to allow people to believe they were actually serving a purpose by giving up their livelihood, willingly erasing their faces by covering their faces with masks, even though the Attorney General of the United States says if healthy people wear masks, it's only going to make them sick. There's no reason why masks should be mandated, and technically, as the Ohio governor found out, they really don't have the authority to do that. Now, I'm not telling anybody not to wear a mask, but that is my biggest problem with Pennsylvania right now, because we didn't have to wear a mask when the state was shut down on March 16th. We went a month without wearing masks, and then all of a sudden, people started protesting. We've been shut in for a month. Let's open up. Well, all of a sudden, Rachel Levine, our Secretary of Health, orders masks to be worn. You can't go into a store or a business if you're not wearing a mask. And I see people walking up and down the streets wearing masks, which is, again, they're telling you, you don't need to do that. Some people are. And then I see them doing this, and they're touching their face, which, of course, that's a no-no. And again, if you want to wear a mask, if wearing a mask will make you feel good and safe when you go out into public, please wear a mask. You have that choice. But we are American citizens, and so that has to be a choice. It cannot be mandated because it is degrading to erase somebody's identity by forcing them to cover their face, making us all look alike. That to me just sends a bad message. And it doesn't look like America to me. And this is still America, and we still have rights. Our Constitution may have been ripped up a little bit and beat up, but it's not shredded quite yet. And this is what we have to do now. As businesses will start reopening with or without the Secretary of Health's approval, a lot of states have already done it, we're going to have to deal with the fact that we have to live with this virus. That treatments will be available probably soon. And eventually, maybe we'll have a vaccine and maybe we won't. But at the end of the day, we cannot stay locked in our homes, not earning a living, depending on Nancy Pelosi and the government to support us. That's not what most Americans want. Some Americans live like this all the time on the welfare and the food stamps. But I've always been a person who believes in personal responsibility, meaning that your health is your responsibility and my health is mine. If I'm not afraid of getting this virus because I think I will have either no symptoms or mild symptoms, well, that's my choice. It doesn't mean I'm going to go visit a nursing home or visit a sick relative who has underlying health conditions. I'm not going to do that. And yet every time anybody says, Cuomo pissed me off so bad yesterday. This is news, Ted. This is new. He was so arrogant, Governor Cuomo of New York, when he attacked a woman who stood up and said to him, I need to go to work. He said, you know what? You want to go to work? You're such a selfish bitch. You want to go to work? You're going to kill people. You want to go to work? You staying in your home watching TV is not death. Why don't you go get a job in an essential business or a first responder, and then you won't kill people? Well, hello, in Pennsylvania, staff in nursing homes, I don't know if they killed anybody, but they certainly came out into our community because that's where most of our cases came from and spread the virus out here when it should have been contained in the nursing homes. All of our deaths in Pennsylvania have been people over 65 with underlying health conditions, except for maybe a very few. And those very few also had underlying health conditions. So this is what I'm looking forward to in the future, because I am restarting my life with or without Rachel Levine's approval. Because again, she's not the boss. I didn't vote for her. And the things she's done have been wrong. I've already reported on them. But real quick, as soon as the protests started, all of a sudden she started counting deaths that were probable, and the death rate rose. And they use fear. Oh my God, we had 300 more deaths in one day after the protest. No, see, 2 days later she had to say, well, no, actually they weren't COVID-19 deaths. Oops, my bad. We have to ask questions. And people smarter than me will research this, and they will find out the political purposes for why more Democrat governors in this election year, when they want to get rid of Trump, are refusing to allow their people to regain our freedom, our civil rights. But Cuomo basically, his brother, Chris Cuomo from CNN, he got COVID. And guess where he got to recover from COVID? In the Hamptons, off New York, off Long Island. He got to recover in a home with a beautiful view of the ocean. And even he couldn't stay in his house. The governor's brother, Governor Cuomo's brother, could not stay in his house for the 2 weeks it took him to recover from COVID. He was caught by a citizen out of his house when he was supposed to stay in because he had the disease, the illness. It's an illness. It's not a disease because diseases usually aren't curable. Most people get over COVID. COVID is an illness. But he had it, and he was outside of his house where he shouldn't have been, and he didn't have a mask on. I have never seen Governor Cuomo, nor my governor, Governor Wolf, wear a mask. So it's funny how they want us to do these things, but they themselves and their families, well, there's different rules for them. And so I hope someone asked the question, and I hope we have answers. And I hope I live long enough to hear these answers, because Governor Cuomo, I have to say something to you if you're watching, and I'm sure you're not. But being shut in, not being able to leave your home, being shut in a small place with your family, not being able to send your children to school every day, not being able to go earn a living to feed those children, well, that can be death, and it has led to death. There have been suicides now reported. People are committing suicide. People who know that they will never again be able to reopen their small businesses, even if the restrictions are completely lifted. They've lost too much. They have no way to do that. My town in Lancaster City, Pennsylvania, I am terrified right now because we are a town of small businesses. And if they don't come back, because we had a beautiful city before this, beautiful little restaurants and cafes and little stores, mom and pop shops, if they don't reopen, this city is going to go to rot. When I was a kid growing up in this very house, in this very neighborhood, it was dangerous in this city. There were a lot of drug dealers on every corner. There were drive-by shootings. And these things still occur, but much more limited. We have a safe, fairly safe city, prosperous, home prices through the roof. A lot of people wanted to move to the city. They couldn't afford to because the housing is great. But if this shutdown continues and these businesses go away, no one's going to want to move to the city. Our home value is going to deteriorate. Businesses, people who have lost everything, will end up on welfare or almost like a permanent unemployment, or they will kill themselves. People don't want to send their children to bed hungry, and they don't want welfare and food stamps. At least most people don't. Some people, they enjoy that. They're used to living like that. But most people in our state are not used to living off the government and off their neighbors. They want to go to work. They want to support their families, and they have that right. And no, Governor Cuomo, I don't want to kill anybody. But see, I have the personal responsibility. And that brings me to the question that is the most confounding for me about this situation. Can asymptomatic people who are not coughing, people who are not sneezing all over everything, can they spread this virus? And that is the question that I most want to hear true experts who spend actual time researching. I want to hear their answer to that, because I saw a very reputable doctor, Mark Siegel, on Fox News. He is not a quack. And he was talking about people who have diarrhea as the only symptom of COVID-19. And he said it's interesting because they really can't spread it. because they just have diarrhea. Okay? So if someone with the symptom of diarrhea cannot spread the disease as easily, he talked about the coughing and the sneezing. So now, why are we saying that someone who is completely asymptomatic or loses, some people have just lost their taste of smell, of their taste and their smell for 2 weeks, that was their only symptom. So if I walk past you on the street and the only thing that I have with COVID, I'm not coughing, I'm not going to sneeze, I'm not going to spit on you because I wasn't raised in a barn. So if I can't smell and taste, me walking past you, now all of a sudden you're not going to be able to smell and taste? I don't think that's going to happen. And I don't think, if I'm not coughing or sneezing, that walking past me on a street is going to spread the disease to you, or me walking into your store for 10 minutes to buy a few things and pay you and walk out. And I can do that without touching you and without you really touching me either. You know, I would have no problem necessarily wearing gloves, okay? But covering my face to me is degrading and I won't do it. So I have no problem maybe just wearing plastic gloves or whatever. They want to give me gloves in the store, fine, I'll do that. I'll put my credit card, you won't touch it, in the little thing, and boom, I'm out. I don't have to touch you. Most stores now have the plexiglass. But again, if I'm not coughing, and yet everybody says it's the droplets that come out of your mouth when you cough and sneeze, how can someone with no symptoms possibly cough and sneeze on someone if they're not coughing and sneezing? Period. The last one, I promise, question, and it's a big one. The deaths. Did the people who we are saying died of COVID, we're being told died of COVID-19, really die because of COVID-19? We are told that, and we know this is true because everybody's saying it, 99% of those who have died, and that's what we were supposed to worry about. Cuomo's saying, oh, don't go out and kill people. You're killing people because you want to go to a beach. You're killing people because you want to feed your children. You're selfish, awful human beings. You're not we. Well, no, we're not we. We care about our families. We come first because we are the ones responsible for taking care of our families. Governor Cuomo isn't going to do it. Governor Wolf isn't going to do it. Rachel Levine isn't going to do it. The secretaries of health aren't going to do it. It's our responsibility. And we need to have a choice. We need to take the risk. If we have low risk of dying from this, then we can get it, get over it. Here's the thing. Get it, you stay the hell home for 2 weeks. I get a sore throat. I don't feel good. I'm not leaving the house for 2 weeks till I feel better. I certainly wouldn't go out and possibly infect somebody else with anything. I don't go out when I have a cold. I don't go to people's houses if I'm invited somewhere. But the death is what we were supposed to lower. And we've done that in Pennsylvania. The deaths are going down every day unless Rachel Levine gets upset that people actually want to go back to work now that we've done what she wanted to do, lower the deaths, and then the deaths all of a sudden spike up. I want to know, and I want someone smarter than me who can get a hold of the death records, the death certificates. I want to know what each person who was labeled a COVID-19 death, what their underlying health condition was. Because we have been told by Rachel Levine herself, all the hospitalizations over 65, most of the deaths over 80 years old in our state, and all, with maybe very small exceptions, had underlying comorbidities. I want to know what the comorbidities were. Because here's what we never had before 8 weeks ago. Every year we know people die, especially in nursing homes. They're elderly, they have illnesses. We know that every year a lot of people, in fact, 600,000 Americans die from cancer every year. We also know that chemotherapy, the treatment for cancer, lowers your immune system and also causes organ damage, causes you to be more susceptible to all infections. People with cancer undergoing chemo can die if they get a cold. That's why a lot of people who are on chemo do wear masks because they need to, because they could get severely ill. When my godmother was going through chemo, if I had a stuffy nose or a sore throat, I could not go near her. I didn't have a virus, I didn't have the flu, but you couldn't go near her because her immune system was so compromised. So I'd like to know, say 10% of the deaths that are attributed to COVID were cancer patients, were stage 4 cancer patients, patients that were terminal, who were expected to die this year from cancer. Did they die of COVID or did they die of cancer? And would they have died this year anyway? Because we don't get numbers like this on a regular basis. We don't get the butcher's list, as they call it, every day. Well, good morning, Pennsylvania. Sad news. Today, 25,000 Pennsylvanians died from cancer. We don't hear those numbers. We know obesity, people who are obese, morbidly obese, which means deathly. You can die because you're overweight. They are highly likely to die if they get COVID. So I want to know if 10% or even a little less, I mean, you're talking a lot of numbers, right? If 10% of the people who were attributed death to COVID were actually morbidly obese, maybe diabetic, high blood pressure, breathing issues, because people who are obese have breathing issues. They get out of breath when they walk up the steps. I want to know that number, because did they die of COVID or did they die of obesity, and would they have died this year, this month anyway? But we don't hear that. Good morning, Pennsylvania. Sad news today. 10,000 Pennsylvanians died of morbid obesity, or 10,000 died of diabetes. We don't hear the numbers. So since we know that almost all of the deaths of COVID-19 were in people, whatever age, but in our state, we've been told by the coroners, it is mostly over 80 years old, and mostly from nursing homes, the deaths. And even Dr. Rachel Levine, who nobody trusts her numbers anymore, has admitted that all of the deaths have been adults and all of the hospitalizations have been over the age of 65. Now, again, if there's one or two exceptions, I get hate mail all the time. Well, I know somebody who was 30 and he was in the hospital for 2 weeks. Okay, but that's one person. The so-called experts are even admitting older people are most vulnerable and people with health issues. So that means that those of us, because I don't know your grandma. Oh, you're going to kill my grandma because you want to go to the beach. No, see, I doubt very much that your grandma who has COPD or is in the nursing home or, getting chemo every day, I doubt I'm going to run into your grandma on a beach or in a restaurant or at a rock concert. I doubt it, because I don't think your grandma, and I don't even know your grandma. So it's not like I'm going to knock on her door and barge into her house and start spitting all over her, because, again, wasn't raised in a barn. So when these so-called experts tell us that because we want our lives back, those of us who have very low risk of dying from this, I'm not saying I'm not going to get COVID-19. I'm saying that I'm not really that concerned. I'm more concerned about the fact that my civil rights, which are more important now than ever, we took them for granted 8 weeks ago. I will never take that Constitution for granted again. But the fact that all of our choices are being taken from us, and Democrat governors especially are totally controlling our every movement, even though the risk of us overwhelming the hospital, even being in a hospital, even having symptoms that are bad enough to even report them to a doctor or even ask for a test. I said all along, if I don't feel well, I'm not going to run to the doctor and demand a COVID-19 test, because I don't want to add to my community's numbers and keep us locked in when I'm going to have mild symptoms and recover in 2 weeks. I just won't leave the house or go around people for 2 weeks. But the bottom line is, you can care about other people's lives, but we're not responsible for other people's lives. I'm not responsible for your grandma's health or her life. Your grandma is responsible. Give you something for an example. My husband has not seen his parents for 8 weeks. Now, he's going to at some point give them a call and say, I'd like to see you, Mom and Dad. What do you think? He's going to let them know, I've been going to the grocery store, but I've been obeying the rules otherwise. I don't have any symptoms. And let Mom and Dad decide. Maybe we'll just come up and sit across the street in the car and talk, and you can sit on the lawn and wave and blow kisses. Or if you want us to come in the house, that's your decision. We need to get the American people back involved in our daily lives again, where we make our own choices based on our risks. And again, no one wants to kill anybody. But I don't want to see anybody I know commit suicide either, because they can't feed their kids or they've lost everything they've worked for. I don't want to see that happen either. And let's remember something else. And like I said, my politics have changed completely during this situation. Abortion is still a choice in this country, even during COVID-19. You can choose to have an abortion. But I'm not allowed to get my teeth cleaned, which, by the way, they were supposed to be cleaned today. $10,000 worth of work here, guys. But my dentist, because of Rachel Levine, is not allowed to clean my teeth, even though I would have no problem going to my dentist's office and getting my teeth cleaned, as long as I don't have to wear a mask, which of course would be impossible since it's my teeth. But women are allowed to go out and have an abortion, and I don't think that's appropriate. I still believe women have a right to choose, because it's their body, their choice. But then I also have the right to say, I'm not afraid to go to the dentist and get my teeth cleaned. And I should have the right to do that. And if my dentist is willing to wear a mask and take precautions and clean my teeth to keep his business running, that should be, again, a personal choice. Nobody's forcing anybody to go to the dentist. Nobody's forcing anybody to go to the grocery store without a mask on. You need to do you, and then you need to let me do me. Because, my friends, that's America. And I want America back. I don't want to reimagine America like Cuomo says and Biden says. We're going to reshape America. No, see, I liked it the way it was back in February. I liked February. I want that America back. So, Ted, I hope you enjoyed the show. It might be a little long for you, but I promise you, I am going to take your advice to heart, because I see Morning Joe every day, and every day he says the same crap. And even Fox News now, every day they say the same crap. It's just repetitive, because really there's not a lot to talk about, and there's not a lot of news. And I don't want to be that person that people tune in and turn off because, oh, it's just her saying the same old shit again. So what I'm going to start doing is reporting only new things that occur in my life and in my beautiful city of Lancaster's life. Because Lancaster City right now, Mr. Cuomo, is dying. Not from COVID-19, but from our Democratic governor and his puppet master, Dr. Rachel Levine's response to it. So, all of you stay healthy out there. Do what you want to do to stay safe, whatever makes you feel safe. But don't be afraid of me, because I'm not out to kill you. I just want to party with you again. Political Paula, out.